Hello, doctors. Hello, all doctors. Um, my name is Ben, and I wanted to talk to all doctors out there. This is a public service announcement to all medical personnel, including psychiatrists, psychologists, and anyone in the mental health industry, and possibly even in the medical industry. I want to have a small conversation with all doctors right now about certain situations that need to be addressed. The certain situations are if people come in to your emergency room and they are generally having a panic attack or an anxiety attack, can you please, for the love of medical science, can you please help them? If you have to do drugs of abuse tests first, please do it. But after that, please give them medication to calm them down. Give them some Atarax. Give them some Benadryl. Give them some benzodiazepines, or give them some Vistral or something to calm them down. Don't ignore them. Don't throw them to the side. They don't deserve that. They're good people at the end of the day. Please, for the love of everything, for the love of the medical field, if you're a regular doctor, you took the Hippocratic Oath. I don't know if you still do it these days, but you should read on it if you haven't. And you need to really look carefully deep into your soul and treat people instead of abusing people, or instead of just kicking them out on the street while they're going through withdrawal, or they're having a panic attack or an anxiety attack, or even actual medical problems. Make sure they're not dying on you. Make sure, please. Don't help everybody. Don't do what has been done to a lot of people like me in the past. Don't ignore us when we're saying and we're coming to the ER room and you see that the vital signs are highly elevated. Don't ignore us and pretend that everything is okay. Just because somebody has an anxiety disorder doesn't mean that you should just shoot them out of the emergency room like it's nothing. You need to really pay attention to these people in the emergency room. Really look into your heart and soul. And remember, at the end of the day, these are human beings too. A lot of them may have drug issues, but when it comes to their vital signs and what they have in their bloodstream, please, for the love of everything, please take care of them. They don't deserve to go through withdrawal. They don't deserve this. But unfortunately, the system, for the people that don't have money, it goes against them. Not everybody can go through withdrawal safely. Not everybody can suddenly stop taking medications like you would want. It's unfortunate, but it is the truth. If somebody has a substance abuse problem, such as taking too many benzos or something like that, and they present to the emergency room, you need to treat them. You need to treat them like if it was an emergency, because not a lot of cities have detox facilities. So you could safely take the patient off of the medication. I don't know if you doctors understand this, but you can't just suddenly just ignore the patient in the emergency room presenting with symptoms such as chest pain, anxiety, shortness of breath. You can't do that to people. Come on, man. Yes, doctors, I know at the end of the day you're medical personnel and you try to make the best decision for the patient. But there are some doctors out there that are just so hateful and so nasty that you would rather have a patient withdraw, seizure out, and die than treat them so they don't die. At the end of the day, you took the Hippocratic Oath. And I think it's just wrong that you could allow a patient, because of your beliefs, you would rather allow a patient to die on you from withdrawal, whether it be from benzodiazepines, whether it be from her or meth, and you would rather have people die on you then treat them and help them get situated. It's pretty sickening that you guys could actually do that. Some of you doctors out there that don't seem to look at the situation at hand. If somebody says they're not a drug addict and you draw their blood and the drugs of abuse are clear, let's say the only thing they have in their system is opioids, or the only thing they have in system is benzodiazepines, and they're coming in with a massive panic attack, are you really just going to let them sit in that bed and suffer for hours? Or are you going to treat the symptoms so that when they leave the emergency room, they can do a sigh of relief? Because at the end of the day, that could be your son, that could be your daughter, that could be your brother, that could be your sister. That could be your family's son or daughter, your friend's son or daughter. You can't do this to people at the end of the day. You can't do this to people. You have to stick up for the people, for the little man or the little woman. You have to stick up for everybody in your emergency room. When somebody comes in complaining, you need to do as a doctor your job. And your job is to protect people from themselves and from others. And if they're withdrawing, you need to treat the withdrawal. You can't just boot people out on the street. You took the Hippocratic Oath at the end of the day. You people are sick. Some of you doctors are sicker than the mental patients. The mental patients, is not their fault that a doctor suddenly stopped writing them prescriptions. It's not always their fault. Sometimes the doctor gets the cold shoulder or gets cold because the DEA or the FDA, Food and Drug Administration, and Drug Enforcement Agency scares the doctors. So they're so worried about losing their doctor's license that they'll stop suddenly prescribing medications, and they stop prescribing them and they go against them because they're scared that the DEA and the FDA may come after them, or at least the DEA. It's kind of sad. But you need to take the patient's life more seriously than your license. If they're not addicted to a medication and they're having a multiple panic attack or anxiety attack, or they're having real medical issues, you need to help them regardless. And at the end of the day, you need to help them. You need to help these people. There's a lot of people out there that need your help. That's why you're in an emergency room. That's why you're a doctor in an emergency room. Your job, no matter how stressful it is to help people. If a person's coming in with a massive panic attack and they haven't calmed down within 30 to 40 minutes and they're shaking in the bed or they're screaming, obviously you need to help them. Sedate them if you have to. But get them to calm the fuck down. They need calmness. That's why they went there. Because they think that they're dying. And the standard test, you should do an EKG as a standard test to make sure they're not having a heart attack. And also do a CT scan of the brain to at least get the basics done to make sure they're not having a stroke or an aneurysm. And if they're not having that or a seizure, at least a basic CT scan with some, basic blood work. A CBC. And you also need to check their electrolytes. That's another one that you doctors need to check to make sure they're not having an electrolyte imbalance. A lot of times I've gone to the ER room and they've checked my electrolyte imbalance and it's been crazy. Low potassium, low magnesium, low folate, low iron. Some people have anemia and then they have massive panic attacks until they treat it. It's actually pretty crazy how many people have actually just had such a bad problem. It's amazing. And all you guys need to do is the proper blood work and care about the patient. Insurance or no insurance, you need to care about the patient at the end of the day. It's almost the year 2021. We're in the future now. Okay? Prescribing a benzodiazepine for a short amount of time or helping people withdraw medication safely would be better than anything else. So help them instead of hurting them. I left the hospital with a vital of 170 over 115. They let me have stage 3 hypertension while leaving the emergency room in Dayton, Ohio, while I was withdrawing some medications from Ativan. I hadn't taken a dose in over 48 to 72 hours. And my blood pressure was so high because of the withdrawal. You're going to let a patient stroke out because your feelings and your license, instead of just properly treating them, admitting them to a hospital for rapid detox. Not even that. It's pretty sad. And then you blame everybody else, or you blame the patient for going through this, when maybe the patient was legally prescribed these medications when he was younger. So please, treat all mental patients good. Don't treat them like nobody. Because at the end of the day, they have feelings and they hurt just like you do. And it's wrong that you guys don't treat them with respect and dignity. And it's wrong that you guys have the audacity to not treat the patient when they need it in an emergent situation. When it feels like an emergency to the patient, sometimes it's an emergency, even though it's not. Please, be more caring about your patients, no matter who they are, where they're from, or the color of their skin. A lot of racism still in these emergency rooms. A lot of racism is still happening. It's sad. Look past skin color and treat the patient because you took the Hippocratic Oath. Remember, your doctor's privileges could be ripped from you really quickly for malpractice. Just remember that. Malpractice is a very serious thing, and you can get your doctor's license ripped and you've been put in prison if you end up hurting a patient. And when I say end up hurting a patient, I mean you're not helping that patient out, and that patient ends up dying from withdrawal when they came into your ER room to get your help. You are reliable. If you're worried about your license, you don't want to prescribe nothing, and that patient dies on you, there's nothing to protect you from you getting lawsuited, fined for millions of dollars, all your money taken away from you from a family member. Malpractice is very real and very scary, and if I was a doctor, I would be worried about that. But I wouldn't be worried about it if I knew I was taking care of the patient. And if they see that in the hospital instructions that you actually administered the medication and they have it in the guy's or woman's system when they passed away, then you're not reliable. So it's better to try to help the patient than to ignore the patient at the end of the day. That's all I wanted to say.